All right, good afternoon, everyone. Thank you for joining us for today's webinar with Dr. Mel Swarnick on treating pain without drugs or surgery. We're going to get started here in just a minute, and I just want to let everybody know that there is a Q&A button on your screen that you can click anytime. You can submit a question anonymously through there, and then we'll answer all those questions at the end of the webinar. Also, everybody who registered and is joining us today will receive a follow-up email that has some information from Mel, how to get in touch with us if you want to, and also access to the recording of this webinar so that you can rewatch it if you'd like to. So again, remember, anytime you have a question, you can click that Q&A button. And other than that, I'll turn it over to Mel to get us started.
Thank you, Kate. My name is Mel. I am the managing partner at Renew Physical Therapy on State Street, and also soon to be opened again, the YMCA. Thank you for all of those who have joined us today. And the topic today is treating pain without drugs or surgery. So to fully understand how we can do that, I think we have to have a good understanding of what pain is. And before I even start talking about pain, the question is, do we want a life without pain? I think if we asked most people would say, yeah, I do not want to have pain. I want to have a life that is free of pain. I don't want to ever have to feel pain at all, because pain is not a pleasant sensation. But if we think about that a little more, we might find that that might be something that's not necessarily a good thing either. There is something called congenital insensitivity to pain with anhidrosis. It's a syndrome. Don't worry too much about the name. It is a very rare condition. The point of this that I'm trying to make, I should say, is that if you don't have pain like these individuals do, it actually can reduce your life expectancy. So the life expectancy for people with this condition is 25 years old. The reason for that is the function of pain at its root is to alert your body to danger. So when you are experiencing something that is resulting in tissue damage, if your body doesn't let you know that tissue damage is occurring, that can cause problems. And so ultimately, although pain is not pleasant, it is necessary sometimes as a warning to alert us to danger and to the fact that tissue damage may be occurring, and to stop whatever it is that might be causing that tissue damage. So as the slide says, pain is essential to a long, healthy life. Now, that doesn't mean we want to have pain all the time, obviously. We want to be in a situation where, for the most part, we are pain-free. But in situations where we have an injury or where there might be something going on that is resulting in disease, that signal that we get from the body and ultimately from the brain, pain is an output of the brain, is warning us that something's going on and we need to change whatever we're doing or do something to address that pain. So to understand what pain is more, I'm going to talk a little bit about pain theories. And the word pain actually comes from Greek mythology. It's derived from Greek mythology. The word peni, I believe, is a Greek word, and it refers to the spirit of retribution, vengeance, and punishment. And so the earliest understanding of pain was described as the price paid for offending God. So people thousands of years ago thought that if you had pain, it was because of what you had done to offend God. Sometimes pain was also thought to be caused by the infliction of evil spirits or demons. As we move along in history, we do find that people started to try to come up with theories about what pain is. And I don't want you to get bogged down with details regarding these pain theories, but I do want you to pay attention to the complexity of the pain theory. So the initial pain theories were very simple. So if you think about Aristotle, who I believe most people would be familiar with, he described pain as an emotion. Later on, much later on, we started to have slightly more complex pain theories. Descartes was one who described pain as a pain system, where there was something that would carry messages from a receptor in the periphery, like your skin or tissues, to a particular pain center in the brain. And he referred to it as the alarm bell theory or the push button theory. So you push on there's a pin that pricks your skin on your hand, and boom, there's a signal that goes straight to one particular center in your brain, and you have pain. And this was an accepted pain theory up until the 19th century. Later on, we started to have more complex pain theories. And the reason for that was because there were many episodes of pain that could not be explained by the simple pain theories that had existed. So an example is phantom limb pain. Why would you have pain that seems to be coming from a part of your body that you don't have anymore? So if somebody has had their leg amputated, but they can still feel pain coming from their foot, why would that be if there's no specific receptor there anymore that causes pain? And there were other examples. Complex regional pain syndrome is a type of condition that occurs when there may be no actual damage to the nerves, okay? There are other instances where you have pain without any pathology of the tissues, or maybe sometimes pain that isn't proportional to the stimulus that is provided. So some other examples on the slides that you can see, but the theories that came later on were try to explain all these types of issues that were happening. So once again, don't worry too much about details on this slide, but just recognize that now the theories are starting to become a bit more complex. And so we starting to realize that pain is really a complex sensation that we feel, and that the system that helps to detect and then make pain to be perceived by the brain really are complex systems. Muller's doctrine of specific nerve energies was described in the mid-19th century. And then Muller also recognized the 5 classical senses, as you can see. Later on, we started to have pain theories that described different types of receptors that were responsible for sensation, and that helped to try to describe the different types of pain sensation that we were feeling. And they also described different nerve fiber sizes that could be responsible for different types of pain. As these theories progressed, you can once again see that we are getting a little bit more complex with the description of these systems and how they work. And we are talking about not just one simple line of nerve transmission, but multiple nerves that are involved, and nerves that sometimes are large, sometimes are small, sometimes transmit sensation quicker, and others that transmit sensation slower. So the central summation theory that you see in 1959, which was not that long ago, does explain most types of pain. But the most recent comprehensive pain theory that really helps to put everything together is something called the gate control theory, described by Melzack and Wall in 1965. This not only just talks about specialization of receptors, fibers, and nervous pathways, but it also talks about other physiological processes involved with pain, and then also something called pain modulation. The nervous system actually has capability to actually reduce pain on its own. And it's very good at doing that in most situations, but sometimes in situations where you have chronic pain, this is one of the things where there starts to be a dysfunction. And we'll talk about that a little bit more after the next few slides. The other thing that gate control theory talked about was spreading of pain, referred pain, and then persistence of pain, even though healing of tissues may have occurred. All right, so to briefly talk about pain nerve fiber types, the 2 main fiber types that we are dealing with here, once again, don't worry too much about detail. The A delta nerve fibers are the nerve fibers that are super fast in their transmission. The main reason for that is because they are myelinated, and that just means that they have a fatty sheath around the nerves. It allows for very fast transmission of signals in the nerve to the central nervous system. The C polymodal nerve fibers are the unmyelinated nerve fibers, and they have a relatively slow transmission of nerve signal. The A delta fibers are very important because they, as you can see, the type of sensation you get with them are going to be like sharp and stabbing types of sensation, very high intensity. This is the type of nerve fiber that is activated when you touch a hot stove, and you need to have a very fast transmission of signal from the periphery where you are touching that stove to your central nervous system, which results in a quick reflexive action to activate the muscle to get your hand away from that stove. And so if you think about a signal that goes 30 meters in 1 second, that's super fast, and you will be able to get your hand off that stove quickly. The C fibers have a little bit of a slower, actually a lot slower transmission of signal. These are the deeper fibers that we have in our nervous system, and they tend to be the fibers that tend to be more active in people who've had pain for long periods of time. So people who have chronic pain, the pain tends to be a little bit slower in onset, tends to be deep and aching type of pain and long lasting, as you would expect with people with chronic pain. So when we talk about pain, and we talk about pain being an output of the brain, I think many people sometimes misinterpret that statement as saying that people are making up pain and it's all in their head. That's not what we mean when we say that. Remember what I said about pain being a signal from your body that there is danger, okay? And so your body is trying to alert you to the fact that something is going on that is causing you to be under threat for some reason. So if we look at somebody crossing the road and there's a school bus that's barreling down at them, and they happen to start to notice that the bus is coming fast and they have to get out of the way of the bus, but they kind of trip and sprain the ankle. They are real-time examples of people doing something like this, where they would injure their body, not actually feel pain. They might know that they've injured their body, but they may not feel pain. The first instinct that they need to do is to get out of the way of that bus. So the body prioritizes what the most dangerous threat that it is to it. I should say the brain prioritizes that. The brain realizes that if we don't get out of the way of that school bus, we are going to die. So you will be able to get up, run as fast as you can, get out of the way of that school bus before you even know that you have any pain in your ankle. Once the threat of that school bus is gone, you're on the sidewalk, the school bus has passed by. That is probably when you start to feel pain. And then there are real world situations where this happens. It happens in instances where somebody is in a war situation, they get shot, they don't even realize that they're shot until they are able to get out of danger, and then they start to feel pain. So that's just another example. So that threat appraisal that your brain makes is a very good indicator of why you would feel pain sometimes and why you would not feel pain other times. And that's an important factor to realize. This slide just refers to the fact that tissue damage certainly is one of the reasons why we might feel pain. But many times, once that tissue damage has occurred and healing has occurred, sometimes people still feel pain. And so we need to realize why that happens. So a lot of times people will come to me, they'll be in the clinic, they may have had an injury 6 months ago, but they continue to have pain. The injury may have been a simple muscle pull and they're able to explain it as such, but they still are feeling some degree of pain. And so what this means is that it just kind of confirms the fact that the pain that you're having is an output of the brain, but it doesn't always correlate with tissue damage. So there are times where there can be actually a lot of tissue damage sometimes. You may not feel much pain, but at other times there may be no tissue damage, or the tissue damage that has occurred may have healed and you still have pain for some reason. Just to talk about this slide in particular, remember that the tissues that contain these receptors, or nociceptors, as we call them, which refers to the danger receptors for the brain that transmit signals via the nervous system to the brain, are just receptors. They don't actually carry some chemical that is defined as pain, but they do carry a signal that indicates that there is something going on that could indicate damage going on. But the brain ultimately is what makes you be aware of that signal, okay? So it's just similar to the fact that, you know, your eyes contain light receptors. They are signals that move from the retina to the brain. The vision itself is perceived in the brain. So vision is an output of your brain. Similarly, the ears contain vibration receptors, but you only actually are able to hear things because of an output of your brain. Your brain is what actually perceives that and lets you be aware of that sound output. This next slide kind of is a good description of what I've alluded to so far. And as you can see, there's a timeline here. So if you look at the bottom left, an injury occurs. There's a great deal of tissue healing that occurs in the area under the black line here. So this initially results in a response where there's an inflammatory response maybe. Your tissues undergo a process where they are actively healing. That response slows down to the point where tissue healing is complete. The blue line and everything shaded in blue refers to the amount of pain that somebody may feel. So initially when there's tissue damage, that high degree of pain that somebody feels is related to the tissue damage. That pain may continue as tissue healing progresses, and it may go up and down depending on activities that the person does. The ideal situation in most instances, and the one that we all hope for, is that this blue line continues to drop off to the point where somebody has no pain, and that coincides with the tissue healing. Unfortunately, that does not always happen, and as you can see in this illustration, sometimes people can have ongoing pain even though their tissues are fully healed, and sometimes that could last several years, and that does happen. Sometimes people have chronic pain issues. And the reason that happens is because the nervous system is sensitized. And so what's happened here is because there's been a relatively long period of pain, there are several factors that make the electrical sensitivity of the nervous system become elevated and stay elevated. And in the normal situation, before we have pain, the electrical level of the nervous system is at a relatively low state. That allows us to do a lot of activities without having to feel pain. When we do get tissue damage, initially that electrical sensitivity is high, and there's a good reason for that. It's because your body's trying to protect you, and it's trying to protect those tissues. But if that doesn't normalize and doesn't come back down to the baseline, even though the tissues may have healed, you still may not be able to do very many things because of the fact that it is quite sensitized. And so getting that electrical level of the nervous system back to that baseline is key in terms of helping to reduce the pain. So long periods of pain can kind of make this worse. So the longer the amount of pain that you have, the worse these types of issues can last. And what that leads to is what we call neuroplastic changes to the brain. That just simply means that, don't worry too much about the details of that, but it basically means that your nervous system is changing the way it responds to input coming from the outside, and it's paying more attention to that input. And sometimes that input, even though it doesn't indicate, or it isn't from tissue damage, may result in an output of pain because the brain is more sensitized. So a good analogy that I give to patients when I'm trying to describe this: imagine you have an alarm system in your home, and it's designed to alert the police or alert you and sound an alarm when somebody breaks the door down. That's normal. If the door gets broken down or a window gets broken, that threshold has been reached to the point where the alarm system should activate. An analogy for somebody who has chronic pain is they have a house with an alarm system that is way too sensitive. So the door may be locked, it may not be even open, but a butterfly lands on that door, and that is enough for the alarm system to go up. Clearly it's too sensitive, and that's not ideal, and it certainly will affect our ability to do things if our nervous system is that sensitive. So environmental stresses can enhance the pain experience. So what I mean by environmental stresses, that could be anything like loud noises, bad weather, crowded conditions where you're in an environment where there's lots of people around you and it's very noisy, temperature where either too hot or too cold, pollution, crime situations where you're involved with crime or war. All of that can amplify the pain that you're feeling. And so going along with those last two examples, anxiety itself can increase pain. Fear of movement can increase pain. Because we're not moving as much, we are not allowing our nervous system to recognize that certain muscle activation and joint movements are normal. And so when we do move the joint or activate the muscle, that can potentially cause pain, because the body is so, you're so fearful of moving that your body perceives that there is something that's going to be dangerous to it, and therefore you feel pain. You feel that as pain. The other thing that's very important is that long periods of pain leads to reduced output of what we call endogenous pain relieving chemicals. So your body actually has the capability to produce its own painkillers. And that's what I was talking about in the earlier slide when I talked about pain modulation, which was described by Melzik and Wall in their pain theory. So your body can release chemicals such as endorphins, enkephalins, dynorphins, or GABA. And those are all neurotransmitters that actually have an inhibitory effect on that nociceptive signal that comes into the spinal cord. So your body does have the capability to dampen pain or dampen nociception. But when it is sensitized, it actually stops releasing those chemicals. So you have less endorphin being released, less GABA being released. And so therefore, there's nothing stopping those signals from reaching the brain, which can obviously enhance and prolong that pain signal. So this slide is just an example of the fact that there's not really only one pain center in the brain. There are a number of areas in the brain that will become active when nociception comes in from the periphery into the central nervous system. And a lot of that could be due to factors that we've talked about. So centers in the brain that are responsible for fear, centers in the brain that are responsible for cognition, centers in the brain that are responsible for emotion. Obviously, the sensory centers will be active. All of those acting together can actually amplify pain. And so this just goes back to the pain chemicals that your body can release. And I did talk about that earlier. Those descending pathways in situations where we have had pain for long periods of time, those are actually shut down. The brain kind of shuts down the release of those chemicals because it wants to stay alert. It's trying to pay attention to what it perceives as a threat, and so therefore it doesn't want to inhibit any signals at all. So this slide kind of refers to the fact that we do have widespread implications for multiple body systems with pain. And so whether we're talking about emotional issues, social issues, physical issues, neurological changes, it can affect multiple body systems. And so we need to recognize that when we are dealing with pain. So that was a lot of information. Hopefully it wasn't something that was too difficult to follow. But the basic thing I want you to take from all of that is that pain is a very complex perception, complex sensation, and we need to be aware of why we may be having pain for long periods of time. So let's move on to pain solutions. So just what I kind of implied, we need to have a good understanding what pain is and recognize that pain does not always correlate with tissue damage. But when we do have acute pain because of trauma, so if something happens and we injure our body, we need to recognize that. Okay, we need to take the necessary steps to allow the tissues to heal. Depending on the type of tissues, there's going to be different timelines that we need to follow in order to allow that tissue to heal. And recognize that the body does have the tools to heal those injured tissues. So the problem, there can be a couple of different issues that happen here. sometimes people don't recognize that they need to allow those tissues to heal, and they do too much. So they may actually be in a situation where tissues haven't fully healed, their pain's gone, and so they think they can do whatever they want. And a great example of that is somebody who's had surgery, and we have to follow a specific protocol in terms of activities that they are doing. They sometimes will do too much too soon, and therefore cause re-injury to those tissues. So we do want to respect the timelines in terms of how long it takes a tissue to heal. On the other hand, the opposite extreme is somebody is so fearful of re-damaging those tissues that they don't move at all. They do too little. They don't allow their body to respond in an appropriate manner, and they don't place any stresses on the tissues to facilitate strengthening of those tissues. So that's kind of what physical therapy is a lot. We want to load the tissues in an appropriate manner, but we want to do it in a way that allows the tissues to heal, but at the same time helps them to get stronger and be able to tolerate loads as we continue to move along that timeline. So just recognize also that, sometimes when we have surgeries, there's more evidence coming out that non-surgical outcomes are very similar, provided the necessary steps are taken to facilitate that healing process. So there are protocols for Achilles tendon ruptures, ACL ruptures, meniscus tears, disc herniations, where we can actually do things as provided we follow the correct protocol to allow those tissues to heal, where they can heal without surgery. I'm not saying that you should always not have surgery, because surgery certainly has its place. Surgery is very important, but recognize that the body does have really great potential to heal itself, provided you do the right things. So a big thing that you can do is recognize that movement really does plays a great role in helping to relieve pain. A great phrase is motion is lotion. And so we talked about how, getting things moving will allow those tissues to start being able to tolerate loads a little bit better. But by moving the tissues in a way that doesn't amplify your pain, actually helps your nervous system electrical baseline to settle back to the normal level, and helps the body to release those chemicals that help to inhibit the pain sensation. So we need to take into account certain factors when we start to move. How much tissue damage has occurred? What is our current level of strength, endurance, flexibility, and function? And we need to consider fear of movement. So when we are talking about patients who have been injured, we take all of those things into account, and we do encourage movement at the appropriate level. Moving at the appropriate level, where we are not causing somebody to be in great deals of pain, but maybe nudging up to that pain, maybe getting a little bit of soreness, but backing off. What will start to happen is people will be able to start tolerating that activity, and then start to be able to do more over a period of time. So this is kind of what I've just alluded to. Graded exposure and pacing of activity is important. So depending on the condition, there's going to be a different timeline that you can move along in terms of progression of whatever activity that it is, based on the injury that you've had. So you always want to start slow. And if you come into physical therapy, we can help you and give you guidelines, but you may not need physical therapy. Any type of health professional or exercise physiologist potentially could help you with it. Obviously, if you've had a specific injury where you need modalities or some hands-on treatment, therapy can be very helpful. But remember that when we are increasing activities, we want to do it in a slow manner. So a great example is somebody who's had a knee injury, and prior to the knee injury, they were walking 5 miles. They have a knee injury, they can't walk, but then they start to feel slightly better. And maybe they have a day where they don't have pain, but then they decide they want to go on a 5-mile walk again. And oftentimes that's too much, too soon. So what you want to do is you want to start at a much lower level. Just make sure that you don't flare the pain up. So maybe start at 1 mile. If you don't have a reaction to that, obviously, if you don't have pain while you're doing it, don't have a reaction to it the next day, then you can start gradually increasing that distance. A little bit of soreness is okay if you're getting back into activity, but moderate to severe pain is not okay. If you push too hard, too fast, what can happen is that pain that's been persisting, especially in conditions where you've had pain for long periods of time, what that can do is it can increase that sensitivity of that nervous system, make sure it'll make that electrical level of the nervous system stay high. And it's not going to allow that electrical level to go back to the normal baseline. So remember that when you are getting back into activities, if you are trying to get back to your normal activities. Other things that are really important to recognize is that good nutrition is important. So having adequate intake of protein. Protein is very important for structure and for building blocks, but it's also the workhorse of the cell. It really is so important for so many different things that that our cells do. And so people who are trying to strengthen or get back into activities, if they're not taking that protein in and not eating adequately, that can be problematic. Obviously, taking the adequate amount of carbohydrates and fats for your fuel, and then taking vitamins and minerals, which you can get from normal nutrition. I'm not saying you have to take supplements, but vitamin and minerals from a normal, healthy, balanced diet are very good for tissue and system support as well. Sleep is great. 7 to 9 hours of sleep per night is great for cognition and skill development. So if you're trying to get back into an activity that you haven't done in a while because you've had pain, sleep is a really great part of that whole process of getting back to where you need to be. It really actually does help with neuroplasticity. So we talked about neuroplasticity as being a factor that occurs when pain persists, but we can also use neuroplasticity to help to reduce the sensitivity of the nervous system. So by making your nervous system and your brain aware that it's actually okay to activate a muscle, it's actually okay to move a joint in a particular way, that's one of the things that helps that electrical sensitivity to reduce in the nervous system. And then also sleep will help with reduced anxiety. It'll help improve mood, improve your immune function, and help to reduce inflammation, and obviously give you some more energy as well. Physical therapy and occupational therapy are great. Obviously, coming from me, a physical therapist, you know, if you do come in with a pain condition, we will obviously evaluate you, do an assessment of the condition that you have, and we'll try to do things that help to promote tissue healing. So we'll try to get you to do certain movements or activities that help to address any impairment that you have and help you get back to your normal levels of activity in a way that's safe and is not painful. Hopefully physical therapists that you do attend do try to make you feel better when you leave the clinic. I think that's one of the things we do at Renew is I always tell my patients, when you leave the clinic, you should always feel better. That's our goal, at least. I'm not saying it happens with every single patient, but if we're doing something that's not making you feel better, we need to change something. So if you go to a physical therapist, you should always feel better when you leave the clinic. Aerobic activity is great. Any type of activity that helps to elevate your heart rate to a safe level for your age is a very good thing. And there are many studies to demonstrate that it can help with pain modulation. So by doing these aerobic type of activities, it can actually help in the long run to bring your pain down. But once again, remember that we want to make sure that when you're doing these activities, you are doing it in a way that your body is used to. So if you're going to start any type of aerobic activity that you haven't done, start slow. And then there's some other things that are very helpful as well. Meditation, yoga, simply having interaction with friends, the social interaction, having fun with your friends, laughing is great. And then setting goals has been shown to be very helpful in terms of helping you to achieve a target, helping you to increase your activity levels in a way that's going to be helpful and in a way that'll help you to reduce your pain. So quick summary before we get to questions. Pain is normal. We need pain to help warn us of danger, but living in pain is not normal, okay? So remember, we do need pain. It serves an important function, but you should not be in pain 24/7. Pain is not always necessarily an accurate reflection of tissue health. Just because you have pain doesn't mean that the tissues are damaged. It could mean that, but it doesn't always necessarily mean that. And so making adjustments to what we know about pain, making adjustments to how we behave, what we do, both mentally and physically, are some of the keys to helping to reduce pain. So brain neuroplasticity is very important. It's an important concept to recognize in terms of why we have chronic pain, but it also helps us to actually reduce that pain if we do the right things. So remember, motion is lotion. All right, so I'm just gonna let you guys know that if you do have questions and you're not sure if physical therapy can be helpful for you, we do have 15-minute screens which are free in the clinic, and you can come in and ask questions to see if physical therapy could help you. We do have a number of locations that you could go to, and I think that should do it. I'll open to questions. So Kate, do we have any questions?
Thanks, Mel. We do have a couple questions. I have some from people who registered, so they submitted it with their registration. I do have a live question as well. So the people
Okay.
who are here with us live, you can still enter a last minute question if you'd like to. The first question I have is somebody just asked about pelvic and stretching for lower back pain. So maybe you can just kind of touch on the relationship between pelvic pain and low back pain.
Yeah, so when we talk about, I'm assuming you're talking about the pelvic organs, the pelvic structures within the pelvis. Obviously, you could have pelvic pain from a pelvic joint like the sacroiliac joint, or pelvic structures like muscles that attach to the pelvis. So certainly stretching can be a nice way to provide input to the central nervous system. And provided you do the stretch in a gentle way, I always encourage my patients to do gentle stretches in painful situations. We don't want to, remember, we don't want to amplify pain. So we want to do pain in a way that is going to, do stretches in a way that is not going to amplify that pain, but it's going to maybe just nudge up to that sore point, and then back off. And then what would tend to happen, you will get the release of those chemicals that help to relieve pain. But you'll also, because the sensitivity of the nervous system goes down, it actually results in the muscles being in less of a protective spasm. There'll be less tension in the muscles, and you'll be able to stretch that muscle a little bit further. In terms of pelvic organs that can be painful, we do have pelvic health therapists that can help you deal with that, because those pelvic structures can actually refer pain into the lumbar spine and in and around the pelvis. So it's certainly something that can be very beneficial. There's some good stabilization techniques that the therapist can provide for both the pelvic floor and for the abdominal muscles as well. So definitely a great question. Very complex in terms of how to answer that one, but hopefully that helps you.
Yes, thank you, Mel. I know you touched on this a little bit, but we had a question from somebody who's here with us live on how like emotional pain from grief and loss and possibly even PTSD can kind of affect physical pain.
Yeah, so if you think about the multiple brain sensors that I talked about that are involved, that actually light up when they've done studies, imaging studies of the brain when people who have pain, they actually see that multiple different areas of the brain are activated and all kind of interconnect to produce that output of and perceived pain. When you have fear of something occurring, remember the nervous system and the brain in particular is trying to stay attentive to any type of potential danger. And when you have fear of something, that will actually really increase the attention that the brain is paying to whatever body part that might be painful. So that can actually cause that amplification of the pain. And then there may certainly be something that can be potentially stressful for the tissues. That fear of that pain being something that can really cause a lot more damage can make the pain feel worse. But another way to think about it is think about, if you sitting back and you close your eyes and you think about sitting on a beach, sometimes what might happen, and if you close your eyes, you might actually smell the the smell of the beach or the flowers that you were sitting around when you were on the beach, or the salty breeze that comes across, wafts across your nose as you're sitting. And so your brain is very good at bringing back those perceived sensations. And pain is kind of similar in that sense. It can actually result in pain being perceived, even though you may not actually have tissue damage going on.
Wow, yeah, that makes a lot of sense. Thank you for sharing that. I just have one more question unless we get any last minute ones coming through. Somebody registered said they have extreme, intense, radiating, unexplained pain in their elbows. Just wondering if you have any first things to try, anything they should pursue to get that figured out.
Extreme intense radiating pain, that could be a few different things. That description kind of sounds like it is an actual nerve compression or irritation, and oftentimes that could be coming from the neck, depending what part of the elbow that is. It could be different levels of the neck that could be involved. So I would, first of all, anytime somebody has a new onset of pain, which is sharp like that, that does seem to indicate potential tissue damage. So I would try to find positions that help to relieve that pain. And then if you want to try things like ice or to help relieve that pain, that could be helpful. That's going to be more effective if it's something like a muscle strain or tear. But finding positions of comfort can be a good thing to do. And I'm sorry I'm so vague in my response, but it's hard to say exactly what it could be, because that may be because of a local elbow injury, or it could be because of a neck injury, or a nerve that supplies sensation to that elbow in the arm, or an actual nerve root in the neck itself. So hard to give actual details, but the general response is find positions of relief. Hopefully what will happen after 2 to 3 days is that acute inflammatory response will kind of settle down, and then you'll be able to hopefully move a little bit better. And if it doesn't improve beyond that, that might be time for you to go see your medical professional.
That's very helpful, Mel. Thank you. That's all the questions I have. I certainly learned a lot, so thank you for doing this. I hope that others did as well. And just a reminder to everybody registered, keep an eye out for that follow-up email. It'll have a couple tips from Mel, how to get in touch with him if you'd like to, and then a copy of the recording as well, so you can re-watch if you would like to. So thanks again for joining us, and thank you, Mel.
Thank you, everyone.